In this video, we will be talking about CBT, Cognitive Behavioral Therapy. My name is Janelle, and I will be providing a general overview. Next, Esther will describe the theories and models within the practice. Giovanna will describe the techniques, principles, and settings where it is applied. And Christina will talk about what the literature says about CBT. CBT was developed in the late 1970s by Beck, Rush, Shaw, and Emery. It is based on cognitive therapy, which seeks to help clients identify negative thinking and behavior, and teaching them social skills, cognitive reframing, and how to better relate to others and change negative behavior. In CBT, the therapist first develops a collaborative relationship with the client, and as they work together, they develop a rapport and they establish negative behaviors and thinking that they want to change. Cognitive behavioral therapy is structured, manualized, and time limited. Treatment is usually 8 to 12 weeks, and the therapist and client meet for 50-minute sessions. And the therapist typically assigns homework. CBT is the most studied psychotherapy for the treatment of depression and a myriad of other disorders. And next, Esther will be talking about different theories and models.
Cognitive behavioral therapy is based on the theory that our thoughts affect our feelings and behaviors, not necessarily external things such as people, situation, or events. The benefit of this theory is that we can change the way we think, act, and feel in a more positive way, even if the situation does not change. Another key theory underlining CBT is behavioral theory. This theory recognizes that maladaptive behaviors are learned rather than inherited. A prime example of this is Pavlov's classical conditioning experiment. The CBT model goes a step further than the conditioning model by theorizing that conditioning not only affects behaviors, but also leads to the development of those thoughts and feelings that can shape those behaviors. Now, let's talk about the different models of CBT. Cognitive behavioral therapy is a combination of several approaches, which can include the model of cognitive therapy, the ABC behavioral modification model, rational emotive therapy, and dialectical behavioral therapy. So as you can see, CBT does not exist alone as a distinct therapeutic technique. To further explain the concept behind this, let's take a look at the following diagram.
This diagram represents how CBT utilizes several techniques from each of these modalities. These techniques include client assessments, cognitive reframing, social skills, mindfulness, relaxation techniques, and homework, among many others.
Hi, my name is Giovanna Cook. And during this part of our project, I'm going to be talking about the techniques, the principles of cognitive behavioral therapy, as well as to what kind of professionals use CBT and where is it highly used. One of the essential techniques of cognitive behavioral therapy is assessing the client with inventories, tests, and scales to identify the frequency and severity of their symptoms. Without utilizing these inventories, a professional can easily miss the real underlying causes of a client's problem. After all, let's keep in mind that for many individuals, it is really difficult to talk and describe their emotions and problems.
Some of these assessment tools include the Beck Depression Inventory, the Self-Report Questionnaire, and the Beck Anxiety Inventory, among others.
Another main technique of cognitive behavioral therapy is helping the client identify negative thinking. It is the social worker's job to pinpoint when the client has engaged in a pattern of negative cognitions. For instance, let's take a look at the following model that explains how negative thoughts can affect other areas of the person's functionality.
The concept behind this model indicates that negative automatic thinking is often interrelated with behaviors, feelings, physical reactions and symptoms. For instance, a person who constantly engages in this harmful pattern of thoughts is more likely to suffer from depression and anxiety. Many research studies have shown that negative thinking increases low self-esteem and increases maladaptive behaviors such as smoking and drinking. It also increases family conflict, interpersonal relationships, and affects their occupations.
Now, let's take a look at the major principles underlying cognitive behavioral therapy.
CBT is based on an ever-evolving formulation of the patient problems and individual conceptualization in cognitive terms. It requires a sound therapeutic alliance. It emphasizes collaboration and active participation. It is goal-oriented and problem-focused. It initially emphasizes the present. It is educative, aims to teach the patient to be her own therapist, and emphasizes relapse prevention. It aims to be time-limited. The sessions are well structured. It teaches patients to identify, evaluate, and respond to their dysfunctional thoughts and beliefs. It uses a variety of techniques to change thinking, mood, and behavior.
What professionals practice cognitive behavioral therapy? Clinical social workers, mental health counselors, cognitive behavioral therapists, and other professionals working in the mental health field. Now, Christina is going to be talking about the research underlying cognitive behavioral therapy.
So my classmates have already discussed what CBT is and the methods, techniques, and principles behind CBT. So let's talk about the research. As discussed earlier in the class, an advanced generalist practitioner is expected to use a progressive knowledge of intervention methods and to integrate this research knowledge into our own practice for the betterment not only of our clients but of the entire profession. This reflects our commitment to the core social work value of competence and evidence-based practice. So what does the research say about cognitive behavioral therapy? We looked at peer-reviewed scholarly journals and included several meta-analysis studies for discussion. We found many favorable outcomes which support the use of CBT across a wide range of disorders, including efficacy with mood, impulse, and even psychotic disorders. But let's start with the mood and anxiety disorders. A study in our textbook reported that clients in CBT for depression had half the likelihood of reoccurrence compared to those treated only with medications. More notably, CBT has been found to be effective across a wide range of age groups, which makes CBT very versatile in the treatment of depression. A meta-analysis study published in the Journal of Counseling and Clinical Psychology found CBT to be robustly effective across the spectrum of all adult anxiety disorders, showing a 78% improvement rate. The Journal of Evidence-Based Social Work published a meta-analysis in 2010 that showed bipolar patients using CBT with a greater reduction in depressive symptoms than 61% of the others. Another study in 2011 reported that with CBT, hoarding patients decreased their symptoms by 31%. With sleeping disorders, CBT decreased primary insomnia in 70 to 80% of the patients. And even more encouraging, the prevention of reoccurrence was cited at both follow-ups. Another important positive outcome can be found with mania. Results of a 2010 meta-analysis found that the average participant receiving CBT had a higher reduction in manic symptoms than 60% of the other participants. This is especially relevant because mania was previously believed to be unresponsive to psychotherapy. Even in the area of psychosis disorders such as schizophrenia, we see that CBT can be operative in addressing maladaptive beliefs that contribute to both hallucinations and delusions. Schizophrenic patients using CBT had a greater reduction in symptoms than 64% of those in the control groups. While CBT is a useful evidence-based practice, it should be noted that there is still much research to be done and there is no one-size-fits-all approach. For example, recent research comparing long-term psychodynamic psychotherapy to short-term CBT therapies shows that the longer-term psychotherapies may have significantly higher outcomes, but the jury is still out. Furthermore, little is known about the ability of CBT to be effective in treating some disorders in ethnic minority groups or those from cultural diverse backgrounds, so we must be cautious. You might recall your parents asking, if your friends jumped off a bridge, would you do it too? And I think this question is still relevant to us today as social workers. Though everybody seems to be doing CBT, this does not mean CBT is always suitable. As the text for this course pointed out, just because we don't find strong evidence for other therapies doesn't mean that other therapies might not be more effective. Ultimately, the client is the final testament to the effectiveness of CBT, and it's our job as social workers to provide a client-centered intervention that considers the client's characteristics, their context, and their specific values and expectations. At the same time, the social worker must be responsible for using their professional judgment, their experience, and their social work understanding of the person-environment fit to effectively determine the most advantageous treatment intervention method. In the demonstration part of the video, our team is going to show techniques that can be used for clients who are reporting depression symptoms. Specifically, we're going to show some client assessment. We're also going to show negative patterns of cognition and how the therapist can intervene to help the client identify and modify these negative patterns of thinking. Lastly, we're going to demonstrate some relaxation techniques that can be used to reduce the anxiety symptoms and the psychosomatic complaints.